Hi, everyone. I hope everybody's having a good day. Very excited to share with you and also learn from you some of the insights on health coaching, and in particular, how combining health coaching with technology can actually expand access to the benefits that health coaching has to bring, in particular in the case of weight loss that we're going to look at today together. And so we're going to cover both the benefits of health coaching, a recap. I'm sure many of you know them, but more importantly, really focus on how technology can solve what we call the access gap to get health coaching. Just before we do, though, it would be very interesting for us to get a little bit of a feel from who is on the call on a number of questions about kind of your experiences with your clients. So Stephanie, if you don't mind putting up some of the questions, and we're going to do just a 1-minute quick poll. The first question we thought we wanted to know is, what percentage of clients that you treat for obesity actually lose weight and keep it off, say for at least 2 years post-treatment? So yeah, feel free to start with that one. I will continue read the other questions because I think you can just scroll them by yourself. The other one is, based on kind of your experience, what percent actually do you think would benefit from health and weight loss coaching? And then what percent of your patients do you think take up coaching? By the way, it can be very approximate. We just want to kind of have a feel of whether it's high, medium, or low. And finally, what do you think is the biggest barrier for patients taking up coaching, in your opinion? There's a couple of options, whether it's cost, location, availability of the coaches, all three. Yeah, I'll give you just 20 seconds or so to have a look, and great, we're getting the first responses. Okay, interesting. Thank you. Thanks for sharing. I'll wait a little bit more and I'll give you an insight, because it sounds already what I'm seeing is quite in line with kind of the research we've seen. So it's always nice to see the correlation. In any event, let me move on. I think what we are seeing a little bit is that we're starting to see that, yes, people struggle, losing weight or at least keep it off. Sounds like quite a few could benefit from coaching. Not many do. And there's a few barriers out there. So feel free to keep on going. I'll just continue with the presentation at that point. I think what we just learned is quite in line with kind of the access problem that I've told you on weight coaching, but the need of it as well. So just quick background for everyone. So I'm just gonna, put up the polling on the side. I'm sure most people actually that are overweight, and especially their support network, knows the fundamental about what it usually takes to lose weight. The research is obviously, there's a consensus around it. I'm just going to pull up the polling down. The research is there's a consensus on the research, of course. It's basically 3 parts on nutrition: follow a healthy diet, basically eating a lot of proteins, fiber, low sugar, etc. Stay active and manage a healthy lifestyle. The issue is usually not knowing what to do, although of course knowledge gap is also a barrier. The issue is more sticking to actually do it, which is often the problems that people have. And when it comes to that, it's obviously a behavioral change problem, to which since the 70s, there's been a good solution coming from health coaching, which is very strong at making people adopt healthy routines. It's been proven to work in pretty much any behavior change. It started off with smoking cessation and is now being used, of course, in many other areas. Let's just zoom into one example when we think of what coaching is. So coaching is not a coach telling the client, do this or do that. That rarely works, this sort of top-down coach knows better approach. It's a very dialogue-based, heavy approach rooted in motivational interviewing, where you start off with a number of techniques. For example, setting a goal for the week on how many breakfasts you're going to have that are going to be filled with protein. And you're going to have a dialogue with the client about, okay, what do you think you can achieve? What is the target that you could put in place? how do you visualize making it happen? What do you need to buy? And by asking the clients all these questions, you achieve a number of things. First, the client talk themselves into change. Second, they anticipate the barriers they can face and actually address them, rather than go next day, oh my God, I forgot, why did I commit to this? I'm not going to do it. And third, finally, when they set a target that they've set themselves, which is challenging enough but realistic, they are much more likely to do it because they are motivated to do it. And so coaching has these techniques that basically make that happen. And that's just the first part of it. Then later in the week, there's a few other coaching techniques being done to make sure that the plan is actually followed. But that example, the reason I chose it is to show you that this approach is very dialogue heavy. Okay, so, and it's going to be an important part, the dialogue heaviness of the approach, requiring a lot of input from the coach. We'll explain in a moment the access gap that I was talking about. The statistics show 95% of people do need behavior support, and most actually need a lot of it. Problem is, health coaches are quite expensive, both in terms of their per hour cost, but also the amount of hours they need to spend with people. There's been obviously an emergence of self-serve weight loss apps, and we're going to talk about that in a moment, but we're going to explain why they're not that effective for most people. And I just want to show you that with a graph. I promise this is the most complicated graph of the whole presentation, but I think it's an important one. You've got on the x-axis sort of the cost, and there, of course, self-serve app are doing amazing. It costs you $10 a month to just have an app telling you, do this, do that, well done, thumbs up, thumbs down. And then on the y-axis, however, you've got the effectiveness. And what you've got is this. First, before even talking about self-serve app, only 5% of people can actually do it by themselves. They read a book, very motivated, high agency, confident. They read a book, they learn about what to do, and they're probably going to make it happen. That's about 5% of the population. The remaining, for example, will use self-serve app. The problem with self-serve app is that these apps are unable to apply more than 20% of behavioral support techniques. So for example, they will provide you some level of accountability. Have you done this? Have you done that? You can press the goal you want, but they won't be, for example, in a dialogue heavy way. They won't give you feedback on your meal. They won't help you address setbacks when things go down. Basically, these apps work very well when you follow the plan, but as soon as you don't follow them, these apps are not working, which is why in tech, actually, the world that I'm originally coming from, doing an app in health coach is very difficult. There's 350,000 self-serve app. And on average, 90% of clients drop off from the app within the first month. And the reason is, as I'm sure you've experienced with many of your clients, everybody's very motivated in the first 2 weeks, but then a problem comes, the plan wasn't great, and the app can't help you. Therefore, these apps don't quite work in that way for many people, just for 10% maybe of the population. So then you've got the remaining 85%. Their only available choice is the traditional health coaches. Health coaches are amazing. They apply amazing techniques that, as I've shown you, are proven to work. The problem is it's very costly. It could cost you up to $500 a month. And then the only way you can drop the cost to a few hundreds a month is if you restrict heavily the amount of time you get with your coach to 1 or twice a month, maybe with a few emails. Problem with that is that it no longer is high touch enough to apply the health coaching techniques I've been mentioning. So for example, if you spoke to your health coach on Monday about the plan, but on Wednesday, the real world situation is on Wednesday, the client, had an argument with their boss or didn't sleep well, and then didn't have time to prepare their meal. And then when they came back home taking their kids, they took a right turn to In-N-Out, and had the unplanned fast food, and then derailed until the next Monday. And then the next Monday with their coach is, well, let's start all over again, because they didn't have the time to discuss the setback during the week. And so just a quick polling again, as a result of this graph, just curious, what percent of Americans do you think are actually using a health coach? Feel free to add it in the chat. Keen to see people's reactions to it. I'm going to look later, but you can start putting it in. what we've got is basically about 1.5% of Americans actually use a health coach. So back to the graph that I was sort of telling you before, if you look at the 200 million adult overweight or obese in the US, like I said, you've got about 13.5% that could probably use either self-help books or a weight loss apps, and they will be fine with that. They don't need too much motivation and accountability. 1.5% will use a human health coach because they can afford it. And then you've got a gap in the market of 85% of people who need behavior support that is quite involved, but can't afford it. And that is the access gap that I was talking about, which in large part explain why people can't lose weight and keep it off, despite their high motivation to try, given the health benefits of doing so. And that has been the picture for a long time. Now, the question is, and the reason I got excited as well personally about this field some time ago is, what is the role that technology can play in solving this problem of both lowering the price of access to a coach, but also making it much more on demand? So we've seen technology do it in many, many sectors, right? I'm not going to compare, of course, this field to kind of Uber driving, but of course, thanks to technology, we have managed to keep the essence of a service while dramatically lowering the price of many services before, whether it is, like I said, taxi driving, the cost of lawyers, the cost of many other things, of services that people get. And I want to apply that for a moment to the world of coaching and in health coaching, share with you the benefits that technology can bring. And when I mean technology, I want to be a bit more specific. I mean automating certain things that coaches will do and bring other things into the form of an app, and together, of course, with a coach. But I will first focus on the technology part. There's broadly two types of things that technology can do. The first, like I said, is to actually automate a lot of parts. You must know, I'm sure I've heard it from many doctors, you tell your clients certain things, and they after the consultation, they ask you a lot of questions. But tell me, are muffins good? Is coffee good or bad? Does it count as part of my drinking water? A lot of FAQ questions that many doctors told me, Jesus, I hope I had like an app that I can just send them the answer. I sent to the hundreds of other clients, right? That, for example, the FAQ is a time spent by a coach that otherwise could have been saved, for other clients and reduce the cost for one client. That's just one example that I think we can all relate to. But automation actually can go much, much further than that. So, for example, it could help guide coaches in their dialogue with the clients. Many coaches have been certified, for example, but they've been certified some time ago. Some people have learned nutrition, but not personal training, or lifestyle factors like stress. When you've got a tool in the background that can actually guide coaches a little bit to answer things, for example, people give their picture of their meal. You can have technology today describing quickly the meal and immediately identifying, okay, there are proteins, there are fibers, I can spot some extra fat. You can limit the time a coach spends looking at the picture. And for example, in our case at Fitmate, which I'll explain you later, you can lower the time that it takes for a coach to give a feedback on a picture from about 3-4 minutes to about 30 seconds. And that's, again, for one feedback, you've saved quite a few minutes out there. And today I'm going to show you as well technology like generative AI that really boomed in the last couple of years can even go further than that and start talking about the dialogues, which I'll explain in a moment. The second benefit, though, is not just that it automates the tasks of human coaches, thereby lowering the human time. It also allows to be on demand. And by on demand, I mean when users need it, not, oh, you might Tuesday 9 o'clock and I'll see you next Tuesday. And if you've got a problem in the week, good luck. But actually, if someone has a craving in the evening and they need support at that moment, that's when they need a coach as well, right? And so if you've got a technology where you've got a coach, but you also have some evening support coaches all working in a platform in the background that can serve one client when they need it, and also provide them some self-serve tools. It could be that at midnight you've got a craving and you've got a tool that helps you ask you a few questions to help you identify the triggers and calm you down. Will it be perfect? Probably not, but will it reduce by a lot kind of those moments where you are kind of taking a risk on all the efforts you've done in the day to watch out on what you eat? Yes. And so this is kind of the benefit that you can have from adding technology. As I was saying, a lot today you can ask the question, well, ChatGPT came about, can it do, can it sort of do much more than that? The answer is absolutely. It's actually quite incredible. So personally, just so you know, I've been doing in tech companies that use AI for the last 15 years. I've been blown away myself over the last 2 years about what generative AIs like ChatGPT can do. So here I'm giving you an example where there's an actual proper conversation going on where if you explain to the tool, oh, my problem is really snacking, Gen AI today is so good at understanding based on past examples about what can actually work for you and really create snippets of conversations where, yes, maybe somebody needs to check them, but it's pretty damn good about how on the point it is, thereby saving a lot of time for a human coach to draft all that answer, which could take a long time, as we all know. And so I think we are just at the beginning, by the way, of technology doing a lot of things. The real question then is, well, I guess, why would you still need a human? Many people ask. If Gen AI can take over, are we in a stage where human health coaching is dead and tech health coaching, is the way to go? Fundamentally, the answer is no. And the answer is no, because humans are essential for a number of tasks that AI can't do and can't be expected to do in the near future, if not the medium future, quite certainly. Time will tell, of course, but here is the research, what it shows. And of course, feel free to add your own experiences as well in the chat. I welcome that as well. I give you a second to think about kind of where do you think the human is still helpful? Feel free to add it again in the chat. Can't see the answers now, but I'll be very keen to see them later. So I'll share with you what kind of the research shows. This basically, I'll break it down to 3 main elements. The first is, however good ChatGPT is, or whichever tool you may have used, some dialogues is just really hard to automate. And I would say for now, because I think that's going to change for sure. Like, for example, when you're having a quite long-winded conversation about why, for example, you didn't go to the gym and you started talking about the fact that your spouse, sort of partner, may have kind of derailed you because they've got healthy habits, you get in a fight, and it becomes a quite complex conversation. Sometimes it's quite hard to identify the underlying reasons that the person are saying in order to paraphrase them back to them. And it's a very important part of health coaching to really understand that. That's kind of the psychology part where it becomes very open-ended. We've tried a lot of things, and there are definitely some parts where the Gen AI can't do it yet. But that will change. There are probably other parts where the human are key. People are just more accountable to other humans. And research show it. Every research shows that when people set goals towards only themselves or towards a non-human tool, like an app or a human, they will always be more accountable to the human. It's just our nature. There's a lot of explanations around it, and that's how we are. And very related but different concept is the empathy created by a coach. The empathy means that you are forming sort of a team bond with your coach. The coach cares about you. And as a result of that, you are much more motivated to try to not let your coach down as a team. I'll give you a personal example. So one of my sort of sins is sometimes I like whiskey at night, and I know that personally I struggle with, you know, one quick shot, you know, from 0 to maybe 1 shot every, you know, a few days. And my wife is next to me and says to me, "Come on, Alon, do you really need it or not?" And I think it's less about the accountability of it, but more about the fact that I know that my wife cares a lot about me and we are a team. And suddenly it sort of brings me back to my sense of self-worth of, yes, you know, she's right. And research is actually showing it, that when a coach is both caring and applies the stick at the same time in the right balance, that is the perfect combination of creating a sort of social contract between the client and the coach. And those three things together make human, unique, and health coaching, which is emerging research shows that when you combine the tech tools that I've mentioned before that help make coaches more productive and human coaches, this is the magic sort of result where a Stanford study has actually shown last summer that when you combine human coaches with tech, it's 74% more effective than weight loss app alone. And it's also more effective than coaching alone. And I invite you to go and look at it. It's quite an incredible study. And so the way we look at it is to say, well, if we've got a problem of access where 85% of people, Americans, could be using a health coach, and we combine on the one hand technology to break down by barrier, and we keep the best of what humans have to offer us, which is really be great humans in a way, then you've got a combination where you can provide a lot of time from a human for a much lower price at the moment they need it. And it's a win-win because, first of all, coaches will enjoy their job much more. They will do much less of the task they don't like to do, the routine automated task. So they will really focus the human part on the really why they came to the job, which will create actually a lot of jobs because there will be a much bigger demand for coaching now that you've lowered the price. And this is kind of how we see the future in that way. With that in mind, I just want to give you an example of how it's being applied in practice by talking a little bit about kind of how we go about things at Fitmate. So as Stephanie mentioned, I'm a founder and CEO of Fitmate Coach. I'm not going to talk to you today too much about what we do. What I want to draw out today is the method that is being applied to demonstrate that this works in practice and how it actually works in practice, so people can picture it. So in our case, when you apply to Fitmate and when you subscribe or when you are referred by a doctor, you could be referred because you are obese or you are obese and you take, a GLP-1 drug, agonist, you will be assigned with a one-on-one coach and a team of support coaches in the evening, and where you will get on an app, basically working a bit like a text message, very simple, no bells and whistles, and where the main interaction is with your coach. The technology happens in the background. From the point of view of the client, they just interact with a human coach that cares about them, that is there every day to apply coaching techniques, covering every week different types of habits on nutrition, physical activity, and lifestyle factors like sleep and stress. So you will do a personal assessment to know which are the habits you need to improve, which are basically preventing you from achieving your health goals. And then there is a very personalized program where every week these habits will be tackled one by one at the pace that actually makes sense for the client, which again, by having a human, makes it not just adopt one more very generalist program, which doesn't work for most people. And so you will be paired with your one-on-one coach, and basically their job will be to apply the health coaching techniques that I've mentioned. And I'm just going to cover them to just give you a picture of that. You will start by agreeing weekly goals in the week. And like I said, that will be smart goal setting, very specific, measurable, actionable goals that are relevant and time bound. So basically challenging, but realistic to achieve. Things that motivate you to work towards, like 5 protein-rich lunches. You will visualize your plan, agree the method of support. So everybody has different methods. Some people like daily check-in, some people like a little bit less. And of course, by virtue of talking with the coach, you can highly personalize it. And the coach, of course, in our program will share exactly the resource we need. But again, that's quite important because, and that's where tech can play a role in. It's not just about recipes, because frankly, many people don't want to do recipes, and they're going to be quite open with their coaches. Listen, I'm just ordering out, and the coach job will be to give you actual order out options. The advantage of working with a centralized tech is that we can centralize all these resources and make sure that all coaches can benefit from highly up-to-date centralized resources, very specific to the client, up to what are the top cereals bar that don't have added sugar, what are the top cereals that are high in fiber, what can you order at Starbucks, you name it. Everything has been covered because we are crowdsourcing all that knowledge, which allows all the other coaches to use it. Obviously, technology. Now you've agreed goals for the week. That's fantastic. And we have Monday, say. Now the week starts, of course, right? And the coach accountability will kick in now. The coach will send you reminders. Good luck, but very motivational reminders. Good luck for your tennis session this morning. Looking forward to see your progress. The client has committed to send their progress. For example, they will send a picture of their meal, and then the coach will actually provide very detailed feedback on, for example, if they had a Cobb salad, which was great, but they added way too much sauce, the coach would congratulate them on the protein, but help them to be mindful to maybe add some, slightly less fatty sauce and focus on healthy oils. And it's kind of a learning by doing one, because the next day they're going to do it again, right? And that's how you actually learn and improve by being motivated that you've succeeded in doing a great protein launch over time. And that building of motivation builds self-efficacy. Continuously built by the coach sending them affirmation on their progress, congratulating them on it. The coach is always available to answer questions or solve setback. Like I said, if the client has a dinner party and doesn't know what to do for the dinner party, the coach will tell them, okay, great, why don't you maybe bring with you a bag of almonds, drink a lot of water, and talk to friends in the party that are slightly more healthy, whatever the technique may be that works with the client. Again, technology can help because we've got a bank of scenarios that the coach doesn't need to invent every time. At the end of the week, of course, as usual, you'll discuss progress, where you are, you'll agree new goals, and you take your measurements. Just to give you a sense a little bit of what technology and human can bring together, it makes it effective. So people lose on average 3% of their body weight after 3 months and 5% of their body weight after 9 months. And more importantly, they keep it off in 87% of the cases. And that's, by the way, because in essence, what we've done is not only the human coaches have kept them motivated to do the actions, but they actually learn sustainable habits. It's not a calorie restrictive program. So actually people are a bit amazed because they don't lose like 10 pounds in the first month. They lose actually a pound a week roughly. But the clients that we work with have been around the block, tried a lot of programs and realized that they need to actually do some proper behavior change. And as a result, learn them and keep them on time. And of course, it's done on an affordable rate. It's always lower than $100 a month for unlimited coaching every day, whenever the client wants. Needless to say, the weight loss is just one health indicator. We track many of them. For example, the resting heart rate, which is a very good predictor of many things, is dramatically dropping down for clients that are using the program. I was mentioning GLP a while ago. I'm almost done, by the way. I was mentioning GLP a while ago, and I think many people that, including in this room, may be wondering, well, why would we still need health coaching if you've got the miracle drug now? And so I think you all know more than this drug than me, so I'm not going to talk about the drug. What I can talk about, because that is the part we've researched a lot and experienced it ourselves, is the benefits of combining. If a doctor decides that GLP is right for a client, so we are not involved in any of that. We are not doctors, you know, we work with our network partners. If a doctor decides that GLP is the right thing, we can provide, and research shows that providing the actual health coaching on the side has a tremendous benefit that you may have seen. I just want to repeat to you kind of what the highlights. So on the left-hand side, you see a graph of the blue one. The blue line is the one you want to look at. You know, it's one of these slides. I didn't produce this slide, you know, so I think it comes straight from an academic research by Dr. Kaplan. And effectively, it's showing you the percentage of body weight drop, which is pretty dramatic, right? If you look at it, you know, after, you know, a little over a year, you could end up losing, you know, 15 to 20% of your body weight using the GLP drug and nothing else. Of course, the issue, as we all know, is that because it's an appetite suppressant, you will regain the weight. And you probably wouldn't have solved the underlying cardiovascular problem, because, you know, as I'm hearing from many people, you know, people still want to go to eat burgers. They're just going to eat less of them, but it's not really improving their health status, and it hasn't really moved the needle on their weight neither. So how can health coaching work when you combine it? For the right type of client. So in our case, we only work with overweight people taking GLP. You know, we don't work with people who are not at least overweight or obese. The key benefits that we are seeing and the research is proving is as follows. The first is, of course, the side effects. Health coaching can help a lot with quite a few of the side effects. The second one is, of course, sustained weight loss, because rather than just being on an appetite suppressant while you've enjoyed the ride of lowering your weight, if you've got a health coach that just helps you slowly to learn the right habits, you know, you will learn them over those, you know, whatever how many months you do the program, so that you are ready when you decide to stop the mitigation to continue on these healthy routines that will see you keep your weight off. Very closely related is the fact that health coaching can help prevent a very problematic issue, is the disproportionate loss of lean mass, which happens if you only take the GLP drug. You just lose too much lean mass along the way, which, as we all know, is quite unhealthy. And, you know, simple ways that health coaching will do that is by making sure you really dose up on your proteins, and you include resistance training, and you stick to it for a while, such that the weight loss is actually properly fat loss, not just, you know, a lot of lean mass lost. And finally, of course, by adoption of healthy routines, you will have lowered your cardiovascular risks. Now, thank you for listening. I think we've got a little bit of time here for a Q&A session. Stephanie?
Yes, thank you, Alan. We do have some time for Q&A, and thank you for that great presentation. I think that research is really fascinating. I love seeing that. So our first question that came in is, what kind of results have you seen in Fitmate clients in the first 6 months of participating in the program?
Basically, in 9 months, it's 5% of the body weight loss, you know, so, you know, so in 9 months is about, and I think at 6-month level, it's quite close to it, because what usually happens is they have achieved their target sort of weight loss, or a big chunk of it, at the 6-month level. And then what we do is spend a lot of time then on maintenance techniques. So for example, once you've learned all the good ways to stay full for not too many calories, then you need to learn to diversify. So we teach them about sauces, a variety of green vegetables, not just focus on broccoli every day to make sure it's not boring. So yeah, so that would be kind of what we see at, you know, 5 months, starting from a 6-month period. So 5% of body weight, sorry.
Okay, great. Next question is kind of on the structure of kind of the coaching plans that you do. So specifically, they say, In your coaching plans, do you provide eating plans, exercising, combination of both? Kind of what's the structure of that?
Yeah, so we focus on nutrition, exercise, and lifestyle factor. But on nutrition and exercise, the way it will work is we focus on each one of the meals, and on each one of the meals, our aim is to help them understand. Take dinners. The goal is to show them to eat a lot of proteins, fiber, not excessive fats, and low sugar. And then in terms of resources and strategies, it ranges anywhere from a recipe to a meal plan. It all depends on what the client wants. And there are self-serve tools today. Only 3 months ago, we've introduced a new tool where people can create their own recipe using Gen AI, where they say exactly what they like. They say, I like chicken and tofu together. I don't care. Make me a Fitmate approved recipe, and they can do it themselves, add it in their plan, and literally create even their own meal plan. We provide meal plans. Our experience is people have their own taste. They usually stop calorie restrictive programs because they're bored of the food. They enjoy living. So we provide a lot of flexibility for people to create their own meal plan. But of course, we will create it if they need. On the exercise side, it boils down, when you work with overweight population, of course, the main part will come from nutrition. The exercise, yes, will burn a few calories, but it's mostly about lean mass and keeping the spirit up. So if somebody has never done exercises, we will literally follow best practices of gradual. First start with 30 minutes walking, very simple, or whichever activities keeps you intrinsically motivated. Then we move them to cardio, following best guidelines from the guidelines in the US around aiming ultimately to get them to at least 150 minutes of moderate activity a week, and or 75 minutes of vigorous activity a week. We will provide them either, go and do tennis if that's what you like, or here is a workout video where you can do cardio. And again, the fact that they work with the coaches will make sure that they can pick what they want rather than follow a plan that everybody else has followed, which is usually a reason people don't do it. And finally, of course, resistance training, which is essential. We actually introduced it quite early on because for reasons people will agree with, and there it's quite guided, so they will follow guided resistance program. Just so you know, we have a lot of resources that are great, but we consider that just kind of the essence. This is not what will make people do it. What will make people do it is the coach helping them to pick the right one and to follow up on it. But we've provided all, yeah.
Great, that's awesome. So with Fitmate coaching, do you have different plan levels? Can people pick kind of what services they want to get? Say if they only want new meal planning, or do they only want kind of exercise type related planning? Do you guys offer any kind of that customization?
So health coaching will definitely be client-led. So if a client tells us that they don't want to do exercise, you can't force them. They're not going to do it anyways if you don't want to. So the best a coach can do is form a relationship of trust where over time they will nudge the client to try it out. But if they are set on not doing it, I mean, a good example is intermittent breakfast. Yeah, it's a very good example. People come with quite a set view. I don't do breakfast. We are not going to try to change their mind on breakfast because it's okay. You can lose weight with, doing intermittent fasting. It's not a problem. We will nudge them to reconsider because on some people, intermittent fasting may create hunger cravings later on. That's my case, for example. I tried it, didn't work for me. So the coach's role is to offer them options, but ultimately it's client-led. What we find, Stephanie, is that over 85% of people are willing to try pretty much the suite of actions, the core suite of actions. And later it branches out. Yes, some people may not care about learning about the 25 other green vegetables having fiber. They prefer knowing how to do a soup with more beans. That's okay. So as long as they have enough vegetables, that's down to preference. But the core is usually done by most people, yeah.
Okay, awesome. Another question that just came in, with your 24/7 support, the patient could be talking with any coach at any given time. How are you supporting the rapport building process between the member and a specific coach on their journey?
Yeah. So I think the issue that is there a trade-off effectively between coach availabilities and many coaches with the intimacy and rapport you can create with one single coach? So it's a great question. And we've spent actually quite a while testing it out. We've tried everything. We've tried one coach only, just 9 to 5. We've tried a team of 4 coaches where you don't have a one coach and you work on a coach. Anyways, and all the permutation above. What we found was the winning formula of striking the right balance between, on the one hand, availability, and on the other hand, rapport, is to have a core coach, what we call the head coach, that you interact with from 9 to 5, and where the key things are happening during that session. For example, the end of week review will happen with your head coach. But when you need support in the evening, you can call on the support team. So it's client-led, which effectively means that a client that cares a lot about the rapport will keep their question for the next day. But at least they've got the option. And that we found was the winning formula. What we found is everybody took on the option to speak to their support and evening coaches, because as long as they can keep the intimate discussion with the coach, but ask an FAQ question to an evening coach, it works as long as it's delivered by a human. And by the way, they also feel like there's a group thing going on. So yeah, so that's kind of the combo that we've adopted.
Great. Wow, that's interesting. Another kind of question sort of along those same lines is there an option for a coach to help assist with real-time proper technique with like resistance training?
No.
No. Okay.
No. And the reason is because I think it's needed for sure. And we don't do it. And the reason we chose not to do it, it's a choice, by the way, we could have done it. The reason is because we specialize in the overweight population, and the core is to get them to do the nutrition action, to get them to do some activity. And doing that right, from our perspective, is more important than getting them to the nth degree of resistance training. I think there are great companies out there doing that, much better than us. Some actually combine, if that's the case. And I think that's right. I think we work in a support network of people, of providers. So yeah, that's kind of the approach we take. Do the things we do very well, which is behavior change.
Right, right. All right. Do you ever work with your clients along with their healthcare providers, or do you only specifically work with like the individual?
The former. So we obviously acquire clients because they come via our website. So we are kind of B2C in that way, but we have partners across the country, medical partners, clinics, beauty salon, hospitals, individual doctors. And the way we work with them is a lot has happened actually in the last year on that. We were quite surprised. I think a lot also happened with GLP clients, doctors prescribing GLP, but not only, by the way, also obesity in general, because health coaching got a bit of a popularity. And I think because of our price is so low that I think we got quite a bit of interest. And the way we work is, and every doctor wants the same, and that's what we want too. So they provide us the client, we get the data, just the data we need, by the way. And then we share back via an API tool, so basically a tech platform, all the key data that our doctors want. And what we found they want is very useful for them is, I'll keep it simple, is 2 broad sets of data. What is the client working on? Oh, now they're working on lowering their alcohol intake. Yeah. And great, how are you doing in that? That also helps the doctor provide input to the client on, I really think, because of your cholesterol, you should speak to your coaches about kind of working on your cholesterol, bringing it down, which is very much in line with the type of stuff we do, right? Because the types of healthy routines we've mentioned will do it. So the doctor, knowing what the clients work on, can input into the plan via the patients. Because again, it's client-led. We are not going to consult with the doctor and just force anything to the client. So if the client comes to us and say, look, my doctor told me this and that, that's how we do it. And finally, the doctor gets weight loss data, of course, and the other health metrics to see whether there's progress or not. So
Okay.
full
So,
quality.
yeah, so that weight loss data that you're sharing with the providers, is that only when you're working with like specifically these healthcare providers or these systems, or do you do that also with like patients who came and found you individually and like, hey, you know, my doctor said I need to lose this weight. Do you ever share statistics still with their healthcare providers?
No, we don't do. It's a good idea, by the way. I'll write it down. We haven't gotten to that yet, actually. But it's a good idea. I like it. But I think for now, I guess the patient will share it. We also, by the way, for HIPAA regulations reasons, I don't think it's our place to do it anyways without the client's consent. But I like the idea to potentially propose that. Thanks, Stephanie, or whoever asked the question. Thank you. I like the idea. Keep them coming.
All right, and then it looks like we just have one last question, and I think this kind of already got addressed. But specifically, it asks, do you hire your own coaches, or do you enter into a relationship with a self-employed health coach?
Both.
Both. Okay.
Yeah.
Oh, it looks like I have one more question. We've got time. Is the weight loss data or the biometric info self-reported from the patient, or is there supportive technology that is sent in sync to the Fitmate account that offers real-time feedback?
For the moment, it's self-reported. At some point, we will add technology. Again, it's a choice. What we found was many people talk about, yes, I'd love it to be, linked to my Apple Health app and all that sort of stuff. And, that's what I do, for example. But what we found is that many clients are very wary of too much tech in the overweight population. They start off with low self-efficacy often. And if we don't even, just so you know how far we go with this, we don't even nudge them to check their weight too much. Of course, we know the research showing that the more you track your weight, the more you're going to actually lose weight because you're going to, self-accountability. But that only works on certain people and less so on others. So we are quite flexible. We make sure that they track their weight at least once a month. Yeah. We nudge them for once a week, but it's up to them. And doing so gives back much more control to the patient. Yeah. Of course, what we also do is we ask them to send, for example, pictures before and after. So we kind of know that they are losing weight, right? So it sort of works. And again, the goal is not to just shred off a couple of pounds before the summer, vacation. The goal is you have an overweight person that needs to go from a BMI of 33 down to 28. Whether we got the 1 pound right or wrong, I think we've done right by our client in terms of cardiovascular risk to lose their weight. And if we can get that outcome without overwhelming them, that's a little bit the approach. But we are experimenting it. We are going to gradually putting in it, but it's about getting it right.
Right. Yeah. Well, that's great. It sounds like you have just a lot going on. But it looks like that's all the questions we have for now. If anybody else has anything, feel free to put those in. But I want to thank you, Alan. Thank you so much for your time. This was, I think, a really informative presentation. I think this is a great service that you guys offer, and you have some great data behind it. It's really interesting.
Thank you. Thank you very much, everyone. We love connecting with people. So feel free to get in touch. I think you've got here my LinkedIn. Feel free to ask questions, share your experience. Feel free to reach out to Chris as well, who is on the call with our medical channel COO. If you want to find out a little bit more about partnering and what we do specifically, feel free to tell Stephanie whether you'd like us to contact you or not. And yeah, looking forward, hopefully, to see some of you at the OMA. We'll be there as well. So that'll be exciting.
Perfect. All right. Well, thank you. And to all of our attendees, thank you so much for joining us today. And I hope you all have a great rest of your day.